Assalamu alaikum and welcome to the Medical Black Book. Our today's topic is
Wound, tissue, and scar. In this chapter, we will discuss the process of normal wound healing, the types of wounds, and the types of scars. Our first topic being normal wound healing. Whenever there is an injury or wound is formed, it undergoes the following phases. The first phase being the hemostatic phase, second, the inflammatory phase, which is for about 2 to 3 days. The next is the proliferative phase, which starts from the third day and extends up to the third week. And lastly is the remodeling phase, which starts from the third week and goes onwards. Now we will discuss each of these phases individually, the first being the hemostatic phase. This phase occurs before the inflammatory phase. In this phase, the vessel wall is completely normal and there is no capillary leak through them. After an injury has been elected to this vessel, there are a series of changes that occur in these vessels. The first being when the vessel is being injured, it starts to bleed. Because of the bleeding, our natural response towards it, the platelet starts to adhere to this respective area and they secrete a substance known as ATP. ATP helps to aggregate more platelets toward this respective area and form a clot in order to block the leakage of blood. Along with that, an inflammatory process has been created in this respective area due to formation of cytokines. These cytokines cause the vessels to become more permeable. Hence, the fluid present within these vessels starts to leak. But before this, after the platelets have adhered to this area and stop the blood, the next step in this, what happens is, it secretes another substance known as the alpha granules and TGF-beta. This helps to aggregate macrophages in this respective area to pass from the semi-permeable membrane, which is formed by the cytokines, to enter into the tissue to eat up the dead debris that is present here. The permeability has increased because of the cytokines effect or vasoamines such as histamine, prostaglandins, and serotonin. This makes the vessel more permeable, hence it becomes easy for the macrophages to pass from the vessel wall inside to the outside towards the tissue. The next phase is the proliferative phase that starts from the third day and extends up to the third week. In this, what happens is now in these tissues, the fibroblasts are present. They mature and they help to deposit new collagen ground substance in order to repair the wounded area. The fibroblasts require vitamin C for this process. Now, when all of these things are deposited in this new tissue that is being formed, this tissue is termed as a granulation tissue. The collagen that is being used in this type of tissue is collagen type 3. After some time, the remodeling phase begins, in which there is maturation of collagen type 3 and it is replaced by collagen type 4 because the tensile strength of collagen type 4 is comparatively more than 3 and it is able to withstand more pressure. Now we will look at some of the normal bone healing. The first example we have is the bone. Now whenever a fracture is formed in a bone, the first phase that is seen in the bone is the inflammatory phase. And this is what happens after the fracture has occurred. A hematoma is formed at the injury site. Macrophages and inflammatory leukocytes move into the damaged area to scavenge the debris and begin producing the pro-inflammatory agents that initiate the healing. The next phase is the soft callus formation. In this, what happens is the inflammation triggers cell division and growth of the new blood vessels. Among the new blood vessels are chondrocytes that secrete collagen and proteoglycans, creating fibrocartilage that forms the soft callus. After some time, hard callus forms. This forms through endochondral ossification and direct bone formation. This forms woven bone replaces the soft callus to create a hard callus around the broken fragments of the bone. Lastly is the remodeling phase. Over time, the mechanically strong, high organized cortical bone replaces the weaker, disorganized woven bone because it is continuously remodeled. And this is the only tissue that heals without a scar. Next is nerve fiber regeneration. Normally, your central nerve fibers cannot regenerate after they have been cut. but the peripheral fibers can regenerate. How do they do this? Whenever a nerve fiber is cut at any part of the axon, the rest of the axon starts to degenerate. This type of degeneration towards the end, as far as the node goes, is known as Wallerian degeneration. Now, this nerve fiber again regenerates by a growth factor such as neurotrophin, and it extends up to its receptor again to be functional. Lastly, we have the tendon repair. Tendon is repaired by two mechanisms, the intrinsic one and the extrinsic one. Intrinsic consists upon the venicular blood flow and the synovial diffusion, whereas in extrinsic, there is formation of fibrous adhesions between the tendon and its sheath. It takes about 3 to 6 weeks for repair. If it is still not repaired or the distance is more, we commonly suture it. Now, what is abnormal healing and how it is caused? Abnormal healing is caused by wounds present at different sites at a specific site. Now, if wound is formed at a specific site, some bony prominences, it will be continuously being enrubbed with that respective area. Similarly, the wound healing would decrease. It also depends upon the structures being involved, the contamination with the foreign body, local factors such as vascular insufficiency, previous radiation, pressure. Systemic factors include our malnutrition. If your diet is insufficient, you would not have the necessary amount of raw material to help with the wound healing. Diabetes mellitus is an immune deficient state which also hinders the wound healing, and certain medications such as steroids would inhibit the inflammation. So if there is no inflammation, there would be no fibroblastic activity later going on or any deposition of collagen in that respective area. Similarly, the immune deficient people and smoking can also lead to abnormal healing. Now the type of wounds. The wound healing is done by three intentions: the primary, secondary, and the tertiary intention. In the primary intention, wound heals if you have an incised wound and its edges are opposed to one another and there is normal tissue in between them. Then these wounds, when these edges are brought together, they can easily heal, and such a wound is a clean wound or a tidy wound. It leaves a small amount or no scar at all. Whereas in secondary wound, the wound is basically avulsed. So the ends or the edges are not opposed. So we leave such a wound, and later on, after some time, granulation tissue develops in this wound and it re-epithelializes, but the scar left behind by this wound is comparatively large. Healing by tertiary intention is this, that we leave a wound open, let the granulation tissue develop in between that, and after some time we suture it together. This is also known as delayed closure of wound. Now the type of wounds. There are basically two types of wounds. It can be tidy or untidy. Tidy wounds are those wounds which are incised, which we have seen here, and they are clean, they have healthy tissue, and there's seldom tissue loss. Whereas the untidy wounds are those wounds which are formed due to crush injury or avulsions. These wounds are contaminated, have foreign bodies, their tissue surrounding them is devitalized, and there is often tissue loss. Now, how do we manage wounds? If there is acute wound, we do this first by cleaning it, exploring it, and diagnosing it. Then we debride the dead tissue, repair the structures that need to be repaired, replace the tissue that is being lost, and cover the skin by grafting. And the closure of the wound should be without tension. Your sutures should not be pulling together the skin. It should be made in such a light condition that there is no tension produced on the skin. So later on, that area could not reopen again. And lastly, we have to do careful handling of the tissue. In a chronic wound, the common example of this is the leg ulcer, which is formed by a prolonged inflammatory phase that leads to the overgrowth of the granulation tissue. The chronic ulcer needs to be biopsied in order to rule out any neoplastic potential. The common example of any neoplasm that can be found in this wounded area are mostly squamous cell carcinoma or marginal ulcer. The treatment of such leg ulcer should be surgery if there is extreme pain, and by mesh skin graft by covering that respective area. By covering this respective area, it allows the patient to have early mobilize themselves. Our second example of chronic wound healing is pressure sore. This is formed by tissue necrosis with ulceration due to prolonged pressure. Pressure sources are formed by undergoing four stages. In the first phase, what happens is the skin is intact with non-blanching redness or localized area. Usually, this area is mostly non-blanching redness is formed over bony prominences. In the second stage, what happens is after some time there is partial thickness loss of the dermis. This presents as a shallow open ulcer with a red pink wound bed without slough. In third, there is full thickness tissue loss, but the subcutaneous tissue may be visible, but the bone, tendon, or muscles are not exposed. In the fourth stage, there is full thickness loss with exposed tendon or muscle. Then, how do we close a wound? We close those wounds which are stubborn and not and have a constant tendency to accumulate abscesses. We use a device known as vacuum assisted closure. This device, what it does is it generates a negative pressure for wound closure. The pressure generated by this device is approximately minus 125 mmHg. The purpose of this device is to hasten the debridement. Debridement is basically cutting off the dead tissue that is no longer supplied by blood, and formulation of granulation tissue. Granulation tissue is found during the secondary healing, which helps that area to recover and re-establish its blood supply. And lastly, we decrease edema by removing the interstitial fluid by decreasing the blood flow. Now, what this results in, this also helps in decrease in bacterial count, increase in the cell proliferation in this dead area. Hence, it provides a stable bed for the graft. Now, a common example that can occur after a wound has been infected and is not properly treated, it becomes infected with bacteria. These bacteria can be of two types, such as gram-positive or gram-negative. Gram-positive include the Staph aureus and the Staph pyogenes, whereas gram-negative includes the E. coli, the Pseudomonas, the Clostridials, and Bacteroides. The most commonly organism affecting the foot, which results in gas gangrene, is known as the beta hemolytic streptococcus. In such a patient, the symptoms are usually pain, crepitation, which is crackling voices when you press this respective area, skin blisters, as you can clearly see in this picture, and the patient, because of the inflammation is going on, there would also be fever. Now, different types of scars. Scars are basically divided into three types: atrophic scars, hypertrophic scars, and keloids. Atrophic scars are a form of sunken recesses in the skin, which has a pitted appearance, and they are caused when underlying structure like supporting the skin, such as fat or muscles, are lost. The common characteristic of these atrophic scars are they are flat, pale, and stretchy, and they are easily traumatized in their early stages, as the dermis and epidermis is thin in that respective area. Our next scar is the hypertrophic scar. It is a subcutaneous condition characterized by deposition of excessive amount of collagen, which give rise to a raised scar, but it is not to the degree observed in a keloid scar. The characteristic of such a scar is that excessive scar does not extend beyond the confines of the excised wound. Basically, the collagen would be found, but it would also be raised, but it would not extend the boundary of the wound that has been formed. Where the opposite happens in the keloid. This is a tough heaped up scar that rises quite abruptly above the rest of the skin. It usually has a smooth top and pink or purple color. The keloids are irregular shaped and tend to enlarge progressively. Unlike scars, keloids do not regress over time, so necessary treatment is being given in order to reduce such scars that are being formed. The common characteristic of the scar, and that differentiates it from a hypertrophic scar, is that it extends the boundary. This is caused by increase in growth factors and by the deposition of collagen type 3. So as the scar cannot reduce, so we provide treatment by cutting this respective area. We can also apply pressure so that this scar does not grow much, or by applying silicone sheets to it, or we can also inject intralesional steroids, which inhibits the inflammation. Similarly, the wound would not heal. Or later on, we can do excision and then give steroid injection, or by excision and post-operative radiation. Lastly, if it is fully formed, we can also do laser therapy to remove it and give vitamin E. Now, what are avoidable scars? How can you avoid scars? You can avoid scars by properly scrubbing that respective area that where a wound has been formed and by cleaning up the wound. And if later on there is misalignment, we can treat it by excision and reconstruction. If your scar has already been formed and is a trapdoor scar, we do W and Z technique. We do this by the help of using microfilaments.